Welcome to True Health Tuesday, and the truth will set you free. Neuropathy. Okay, this is a pet peeve of mine. People are coming in with neuropathy all the time. So we're going to look at it in detail, but the most frustrating thing is when you get on the certain sites, what are they looking for? I mean, I'm looking at a couple of neuropathy sites and they're doing blood tests, skin sample analysis. They're not looking for a mechanical cause. No, peripheral neuropathy has body aspects and visceral aspects. So peripheral means it's going away from the central nervous system. Neuropathy means you have a nerve problem. But no, we've got the body, okay, and visceral organs. If these nerves, since the nervous system controls and coordinates every function of the body, if these nerves are compromised to a sensory input, you're going to have electrical, burning, sharp, and shooting. So if you wake up and you say, man, I got this burning pain, what do you think it is? Pinched nerve, okay? I got this electrical symptom coming down here. It's a pinched nerve. So when you look also motor weakness, balance issues, proprioception, how your body functions in space, these are all can be peripheral neuropathies. Then you look at heart problems. So this is going to be cardiac arrhythmias. That could be an actual compromised nerve that supplies the heart. Look at sexual dysfunction, kidneys, lungs, stomach, reflux, poor digestion, slow gastric motility, constipation. So there's a plethora of symptoms coming around. In order to delve into this world of psychosis, because no one's looking at the mechanical cause. I mean, I'm looking at these websites and they're doing skin biopsies, they're doing blood samples, they're doing complete blood cell analysis, they're looking for everything. And instead of looking at the health of the body, they're boiling it down. In the segmented system of healthcare, it just doesn't work. So let's go over some of the ways that we keep healthcare separated from the average Joe. We use our own language. So I kind of miss the old priest hats that they used to have, but most people have a white jacket, so it separates us from you, regular people. Cora, do you have my white jacket? Stethoscope would be nice too. Yeah. Do you understand? It's weird because, they're not saying, look, your body is smart, you're self-healing, you're self-regulating, symptoms are there for a reason. No, neuro means nerve, pathos means suffering or problem, ology means study, osis means condition of, itis is inflammation, toxins, poison. And so people will come in and they'll say, I have this neuropathy. And it's okay. So it's pinched. No, you don't understand. My doctor told me I have this neuropathy. Okay, cool. It's a pinched nerve. Let's find the mechanical cause. It's generally mechanical. It may be chemical. What type of medications are you taking? No, it's a neuropathy. And it's like, dude, no. Okay. Now we have the automatic nervous system. Okay, and this is located in the skull and the pelvis. That's the parasympathetic, the rest, digest, and repair. Okay, so if you have a problem with this is going to be an altered function, okay, of those organ systems. If you have the sympathetic nervous system, if there's a problem with that, you're talking about the fight or flight system. So if you have an imbalance or stress in your body is going to correctly respond to that stress by elevating the blood pressure, elevating cholesterol, elevating blood sugar. That's a correct response. We have patients all the time going, and man, I was diagnosed with adrenal fatigue. Okay, what's wrong with adrenals? Have you ever heard that term, adrenal fatigue? Okay, there's nothing wrong with the adrenals usually. Usually they're not nutrient deficient. Usually the body is in a sympathetic dominant state. They're in a complete state of stress. They've got physical, chemical, and emotional stress, and their body's responding correctly to this. You go to every homeopath or naturopath and they're saying, yeah, you need adrenal support. Not looking at the underlying cause. Okay, yeah, you got anxiety, stress, and depression. Here, take this selective serotonin reuptake inhibitor. Here, take this, you've got joint pain everywhere. Take this anti-inflammatory. You don't need to look at what the cause is. We're smarter than your body. The common causes. Now, these are off of some medical sites, and what's frustrating when you look at it, diabetes. Okay, we're talking this society is ridiculously sick, particularly when you're talking about type 2 diabetes, and we'll go over the cause and solution for type 2 diabetes. Leprosy, vitamin deficiency, medications, traumatic injury, excessive alcohol consumption. No, we'll go over what excessive is. Immune systems disease, okay, infections. But when you look at this, there's a lot of things that are neurotoxic. Let's look at proximal and distal, okay? And this is where a lot of people get confused. Proximal means close to, distal means away from. And what they have is a typical pattern of nerve distribution. And there's a thing called dermatomes, and there's an area of skin supplied by a specific nerve root. And it's generally similar for most everyone. It's not exactly accurate. Typically, most people are going to draw the C6 dermatome, and what that is, C stands for cervical, 6 stands for the sixth one, and this comes out and supplies this area. Now, so what we're looking at in nerve impingement is the area of desensitization or hypersensitization, because if you pinch a nerve, does it get less sensitive or more sensitive? Say more. It does. It's so weird. But everybody's experienced that. Like if your arm's around your sweetheart and it starts to fall asleep, but you don't want to move it because you think you're really lucky. Okay. And then, so when it comes back, what's it feel like? It's all pins and needly. I know every guy in here has done it. Don't worry. We're not the only ones. Yeah, but when it's pinched, it's all pins and needly. So that's that electrical burning, sharp, and shooting. So, but that's when it gets pinched, it gets more sensitive. So what if you pinch the nerve to the heart? What are you going to get? Cardiac palpitations, arrhythmias, not a smooth flow. So dermatomes helps us to know if the lesion is right back at the spinal cord, so you're pinching one nerve root, or if it's away from that nerve root where it involves a whole bunch of them. So if you have pain, tingling, numbness, ants crawling on your hand, and it's in this area, typically it's going to be a nerve root back of the spine. If it's the whole back of the hand, it could be something further on down. It could be a shoulder trauma or something else. So it's just little ways that you can diagnose kind of close to where it is. When we look at the mechanical aspect, and in preparing for these talks, I look at the medical world or what everyone's talking about, and they're doing blood test analysis, they're doing skin sample analysis, they're doing nerve conduction to velocities, and I'm going, God, there's not one x-ray on here. There's not one x-ray, and we're talking about the top neurologist in the country. They're not looking at a mechanical distortion. Why? Do you want to know? Because they can't fix it. Why are you going to look for something that you can't fix? I mean, if we got loss of curve, scoliosis, traumatically induced buckling in the spine, and they don't have any therapy that'll correct it, all they know is that if the body's like this, do you think the muscles are going to be in spasm? Okay, do you think ultrasounding, electric stimming, or tensing my muscles will straighten my body? No. I mean, I don't know if weed's legal in the rest of the country, but they must be smoking something. Okay, so this is how you find out most peripheral neuropathies. Okay, this is typical of a human being. It's called a failed back surgery syndrome. Yes, there is a billing code for it because it happens so often. Okay, so the reason, and you're going to see this is a picture of a lumbar spine and a pelvis, and those bolts and screws and stuff were not man-made. They were actually put in, or they are man-made. They were put in there by a surgeon. And one of the reasons that this was done in the wrong place is because the surgeon goes in there and says, yeah, you have a swollen disc. Okay, it's right here, right on the MRI. It's bad. Okay, and so you're hurting. This guy is supposed to be an expert, and you trust them. Say, doc, where did you get that? Well, I got it off the MRI. Okay, well, MRIs, if they're done in the supine position or laying down, they're completely inaccurate. Okay, inflammation can distort the MRI. The most accurate assessment of a disc is to do a bending film, and that's what we're doing here. We're taking a distorted spine and bending it, but even if you're not doing a stress x-ray, ask the pertinent question, because your life literally depends on this. Doc, why did that disc break? Okay, is there secondary problems to it? So if the doctor is looking at a swollen disc, so you've just been diagnosed, you got a swollen disc herniation, disc bulge, slip disc, whatever you want to call it. It's a disc dysfunction. Okay, are they checking at bowel movements? Are they checking your gait? Are they checking the feet? Are they checking the forward head carriage, the loss of curve in the neck, any lateral buckling? Or are they just looking at the site of pain? Okay, if they're just looking at the site of pain, you fire them. Okay, because they're not looking at the real source of it. But in here, we can see on this side, there's a person bending off, and there's a person facing us, so that's bending off to the left. And you can kind of see, of course I can't really point this on the thingy there, but it has a pretty arc to it on this side. This side over here is bending, but it's not bending like an arc. Can you see that difference there? And that means that the disc isn't opening up correctly. So now here's a patient who also had peripheral neuropathy. I mean, she was carrying a bag of concrete across her yard, and it hurt her. And they said, look, you know, you're in your 70s, you've had scoliosis for a long time. How about we just put the rods in there and just fix it? Okay, I know. So this is her on the left, and there was a number, I mean, you know, all the 2 bags of bolts and screws and stuff, they took out because I'm looking at this, and they fused her from C3 down to L3, and there's not much moving, but understand, when you fuse a spine, the body starts moving. Okay, you need constant input, so she starts to develop this Parkinsonian shake. Okay, why? Because when you stop sensory input into the brain needs some type of stimulus. So they took all the bolts out and they put more bolts in. Okay, you might say, why do you take the bolts out and why do you have to put them back? Well, because when you're putting the bolts in there and the steel rods, sometimes you got to remove parts of the bone. So you have to have some type of mechanical support because you already screwed up the biomechanics of the situation. And this is her neck. Luckily, before, when they remove the bolts, you can actually see this. Okay, you can see that we actually have more of the bones to work with. So we're able to deal with it, and we're actually starting to control some of her shaking, which is nice. It would have been nice if we got to her before the surgery. That would have been a lot better. And this is probably why, you know, I mean, we get people with surgeries, and rarely do we get them that says, yeah, man, I had this surgery and my life is complete. I feel great. You know, how many people do you think we get in here with multiple medications? You know, doc, I'm on 12 medications and I've never felt better. I know. It's like there's no way. This is my favorite patient case, whatever, in the world. Okay, we get a lot of cool injuries. We've had patients from every aspect of the war. Okay, and I'm talking Japanese Imperial soldier, German Nazi Hitler Youth from World War II. But this guy's job is probably the coolest in the world. He's a lion trainer from one of the royal families in Dubai. And the lions, if they see you limping, they will, as a courtesy, end your life because it's better for the herd and it's their honor. Dude, Bob, I saw you limping today. Buddy, I've always loved you. I'm going to be the one to take you out. I thought it was just cool because he gave us 2 weeks to fix him. I mean, you can see there's a reverse curve in his neck. 50% of all low back injuries, 50% of all lumbar peripheral neuropathies. This means the sciatica, the femoral cutaneous nerve syndrome, balance issues, bunion formation, flattening of the feet. These are all peripheral neuropathies. Electrical burning, sharp and shooting, and then also proprioception. You can see people walking with their feet out wide, where they're going to walk like this because they don't have enough proprioception to maintain their balance. So you're going to see these peripheral neuropathies present in a tremendous fashion. I mean, you know, you're looking at the majority of the population. They say over 20 million people, so you're talking, you know, a good percentage of America has this. And I want to go over and show you what correction of this is. Now, this patient here, obviously, you're looking at a spine that's bent and a spine that's straighter. But if you have peripheral neuropathy in a structural aspect, and that's the most frustrating thing. When you look at these neurologists, no one's looking at the structure. What would a blood test on this guy with the bent spine on the left be? Would he have an elevated ESR or an elevated inflammatory response? Absolutely. He's going to have higher cholesterol rates. Why? Because his body's under stress. Is his blood sugar going to be elevated? Absolutely. The guy's under stress. He's responding correctly. Oh, I got an idea. Let's give him some blood pressure drugs. Okay, does that make him healthier or sicker? It's just a crazy world. Okay, so now when you are diagnosed with peripheral neuropathy, or you suspect that you have neuropathy, if you just have an idea that it's there, find a doctor that doesn't drug the symptoms. Find a doctor that identifies the cause. Doesn't that make more sense? You know, because 69 years old with 2 blood pressure medications, for every 1 blood pressure medication you take, your risk of stroke increases 30%. You know, so now he's got a 66% increase risk in stroke. And we're not even talking about the antacid, which depletes the body's ability to absorb minerals and increases esophageal cancer. And then we look at this guy, cardiac arrhythmias. We know the nerve supply to the heart is the top of the thoracic area. Does it make sense that on the picture on the left he would have cardiac arrhythmias because this peripheral neuropathy is affecting his viscera? And then on the next, he doesn't have it anymore. Does that just make sense to common sense people? Wait, it's not common anymore. Okay, the sense previously known as common. All the respect to Prince. Okay, this is the most frustrating patient because stenosis just means narrowing. You can have stenosis of the body, of the spine, by having a lateral deviation or loss of curve. This is stenosis. You can have stenosis because the discs get compressed. This can cause peripheral neuropathies. Understand that the discs are alive, that the body can change shape. You've just seen that. I've showed you a few pictures, but I mean, you know, we're talking thousands and thousands and thousands of people come through here, and we have pre and post x-rays on them all. This patient comes in with spinal stenosis, seen on what? An MRI. Okay, was he sitting up for that one or laying down? He was laying down. Okay, did they do a stress x-ray? No stress x-rays. Does he have peripheral neuropathy from the stenosis? Maybe, but we know that he's got stenosis. Why? Because if you're missing a curve in the neck, that causes a narrowing. It literally stretches the spinal cord. There's no flexibility of that spinal cord. So this picture on the right is him looking neutral. Now, you're going to see there's not a lot of degeneration, grade 2, a little bit of compressed disc, some loss of curve, but his hands were going numb. Okay, and I told him, I said, look, buddy, what we're going to do, we're going to put a little piece of electric tape around here that's going to maintain the integrity of the median nerve. We're going to get the curve back in your neck, okay, and we're going to restore the nerve supply. After about a week, I'm going to give you a little rubber band. Your numbness and tingling is going to go away. It's going to happen very, very quickly. How could he fix stenosis? And well, we restore the normal curves of the spine, you know, and there's lateral deviations. We're just going to correct it. How do you do that? My doctor said you can't do that. And I said, no, he can't do that. We do before and after x-rays. I said 30 adjustments from now, and that could be as little as like 3 weeks. We're going to get a post x-ray. In 10 visits, which is, in our clinic, if you're coming in from far away, we do 3 adjustments a day. In about 3-4 days, your symptoms are going to start to go away. No, my doctor says not to ever have a chiropractor touch me. I said, wow, that's interesting. We have a similar point of view. I don't think you should be taking the muscle relaxants and pain relievers. Okay, so, come on in, we'll get you adjusted, you'll be fine. So, no, you're not touching me. And he walks out. And so in my mind, it's so simple. It's so clear. What I told the guy, I said, you want to correct stenosis? Look up to the ceiling. What does that do? It gives him a curve in the neck, takes the pressure off the spinal cord. Okay, now you're looking up at the ceiling. How's your hand symptoms? Well, it doesn't hurt now. Okay, does it make sense that if we put the curve back in your neck, that this will decrease the pressure on the spinal cord? Honest to God. I mean, I'm walking him through it, and I'm sharing this with you folks because I'm really frustrated with it. What did I screw up? How could he have been so mesmerized by these barbarians to say, no, you have this thing, this narrowing of the spinal cord from a loss of, structural integrity. And I'm telling him, yeah, you put the structural integrity back and you get better. And this was too hard for his mind to understand. Okay, so let's look at other causes of neuropathy, not just the mechanical action. So you understand, if you have a mechanical distortion of the spine, you can't fix it with a drug, shot, or surgery. The TENS unit won't work. Okay, the cortisone shots won't work. You have to fix the problem. Okay, we're clear on that? Okay, good. Let's look at the drugs that cause neuropathy. Now, this is at the Merck manual, and almost 40 different types of drugs. So drugs for cardiac arrhythmias. No, he did. I don't know why my thumb hit this back to the cardiac arrhythmia patient who used to have them from a peripheral neuropathy, and it was actually a mechanical distortion. I'm sure any doctor, before they give a cardiac arrhythmic drug, okay, beta blocker, ACE inhibitor, or something along like those lines, that they would do a mechanical check over an x-ray to see if the guy's body has got some kind of distortion. Cancer drugs, antibiotics, antivirals, alcoholism treatment, high blood pressure drugs, psychiatric drugs, seizure drugs, anti-rejection drugs for transplants. They're also doing this type of medication for lupus and skin treatments. Now, it's interesting with all of this, the medications that can cause neuropathies, that are the medications safe? Are they prescribed by a group of people that are based in science? So when you look at the Journal of Law and Medicine and Ethics, institutional corruption of pharmaceuticals and the myth of safe and effective drugs. The myth of safe and effective drugs. Over the past 35 years, patients have suffered from a largely hidden epidemic of side effects from drugs that usually have a few offsetting benefits. The pharmaceutical industry has corrupted the practice of medicine through its influence over what drugs are developed and how they are tested and how medical knowledge is created. Wow. So let's look at diabetic neuropathy. I mean, knowing that type 2 diabetes is, they call it insulin resistant, but it's not really insulin resistance, it's a poisoning of the body. If you look at type 1 means there's not enough insulin. Now we know the pancreas secretes insulin, we also know the brain secretes insulin. We're just finding out certain organ systems might secrete their own insulin. So this is kind of an exciting time if you're really a nerd. But when you look at it, okay, so type 1 diabetes means there's just not enough insulin, from some type of damage. Typically it's going to be vaccines or neurotoxins that damage the cells inside of these insulin secreting organs, such as the pancreas. Now type 2 diabetes, because what's insulin's job? Insulin's job is actually to get the #1 energy source of the body, which is glucose, out of the bloodstream into the cells. So insulin goes up, knocks on the cells opens up, glucose, come on in. So they come in there, breaks it down, you get all the energy. Insulin goes up to the next cell, breaks it down, glucose goes in there. Well, in type 2 diabetes, there's so much glucose floating around in the system that the insulin goes up and knocks on the cell door and the cell won't open. So it's insulin resistant. Okay, so what they do is the blood becomes toxic and thick. So blood pressure goes up, No, we're not going to give them a blood pressure drug. Okay, blood pressure goes up because the blood's not efficient, okay, at doing its job. Can you see the mindset though? Gee, blood pressure goes up. How about asking, why? Okay, just for shits and giggles, you know, is the person dehydrated? Do they have a toxic effect? Just going on. Okay, so let's say you get metformin or glucophage, okay? Let's say you get a drug that lowers blood glucose. According to the British Medical Journal, if you lower it 9%, you have a 19% increased risk of death. Okay, if you lower it 14%, you have a 43% increase in death. Death is hard to get over, okay? But wait a second, what was type 2 diabetes from? Oh, type 2 diabetes, can cause peripheral neuropathies, but it's actually from a blood poisoning. This can't possibly be corrected with just diet. Gosh, statins increase diabetes. Wait a second, cholesterol? Isn't that a response to stress? And isn't this that drug that causes increased heart failure and increased damage? And that's not going to fix, cholesterol drugs are not going to fix or clean up the blood. How about we look for the cure for diabetes, okay? I totally recommend you look at this guy's book. Dr. Gabriel Cousins got a video out there called Simply Raw. Brilliant. And he talks about using plants, okay? Plant-based diet, okay, raw, organic, vegan, just for a few weeks. We utilize this method of introducing plants inside of people who have type 2 diabetes, and it works 100% of the time. Within about 30 to 45 days, they no longer have it. Okay, and the kind of conversation that goes on with this? I say, look, your blood is toxic, it's not healthy. Okay, you're not going to eat animal products for around a month and a half. Okay, what about eggs? Okay, eggplant will be okay, but no animal products. So that means fish is okay too, right? No fish either. Okay, what about lamb? Okay, I know meat, but meat's that big cow-like creature, right? Okay, what about chicken? No. Meat. Honest to God. So what's the solution for neuropathies? It's going to sound ridiculous, but it's very, very simple. When you're told by the doctor that that nerve is slowly dying, to be aware of a pinched nerve, 90% of it's got to be crushed. Okay, so finally, when you get that symptom, 90% of it has to be crushed. So when we do that miracle adjustment, and you got this radiating pain, and bam, pop, wow, the pain's gone. We might have taken you from 91% crushed to 85% crushed. That's why we use the objective analysis of a post-X-ray, rolling thermal scan, surface electromyography, or heart rate variability to gauge at how better you are, okay? So you have to get your nervous system checked. What does this do? You're taking X-rays, stress X-rays, and any other thing that you want. I mean, we use heart rate variability, rolling thermal scan, surface electromyography. Now, find out why medications were prescribed. So if there's 40 medications, 40 types of medications that can cause peripheral neuropathy, and this is the most medicated population the planet's ever seen, and the average person over 60 is taking 12 different prescriptions, I would think neuropathies would be at epidemic levels. Oh, they are, okay? So find out why you're given the drug, okay, and find a doctor, because it's really hard to solve to solve a problem with the same intellect that created the problem. Okay, so you might have to be firing some doctors, but ask them why. Okay, say, hey doc, I just read that this cholesterol-lowering drug can actually cause heart failure and hardening of the arteries. And I just read that this blood pressure drug is actually a diuretic, which is causing me to lose potassium and can cause cardiac arrhythmias. And that's why you gave me the beta blocker, because I'm having these cardiac arrhythmias. All this stuff's upsetting my stomach, and gave me the proton pump inhibitor, but that's causing me to lose minerals, and that's also causing cardiac arrhythmias. So now I've got 4 blood pressure drugs, and my neuropathy is still bad. Okay, do you understand? So find out why. Okay, don't take 2 drugs together, separate them. You know, and that just is common sense. If the doctor says, no, it doesn't matter if you take the metformin, okay, with the beta blocker, with the ACE inhibitor, with the glucophage, with the cholesterol drug, you know, you're gonna be fine. And here's that soma, by the way, so you can get some sleep. Oh no, that's the muscle relaxant. That's the central nervous system toxin. Why would a muscle relaxant cause peripheral neuropathy? I don't know. So find out why you're prescribed the medications. That just makes sense. Okay, and talk to a doctor that is understanding and going to find out that you were prescribed the drugs because you were under stress. And that's it. That's what they usually are. Physical, chemical, or emotional stress. Say, hey doc, I found out it was just a natural stress response. This is why my blood pressure and blood sugar and cholesterol and I wasn't pooping but once every other day, and you know, my sleep was bad and sexual dysfunction and all this other stuff. I was just under stress. Went to a chiropractor, got my nervous system working right, and I'm fine. Okay, so identify and correct the stressors. Doesn't that make sense? Do an x-ray, find out what's wrong, change your diet to an organic plant-based diet, drink more water, and if you have certain nutrient deficiencies, like you've been toxic for a long time, change your diet. Okay? I mean, it's really, really that simple. If you have stenosis, correct it. Discs are alive, they can regenerate. Stenosis can be caused from a buckling of the spine, correct it. Identify the problem and fix it. Typically, knives don't fix it. Okay? Put only healthy nutrients in your body. Anyone got a problem with that? Okay. Can you see why we put these 5 keys to health? It really makes sense. Your body is intelligent. It gives symptoms for a reason. Now, this month at Extreme Health Academy, we're talking about the nervous system. We've got a 14-day challenge. Okay, we're about halfway through that. But you can go back and start it. But it's all changing your nervous system. Imagine if we knew that the stressors, the physical, chemical, and emotional stressors, are actually causing your body to adapt correctly, but that's misinterpreted by the psychotic system that we have into different pathologies. You don't have high blood pressure. Nobody does, okay? But you could have chronic stress that will actually deteriorate your life. Nobody has indigestion, but you can have a stress response that decreases acid in the stomach, causing the lower esophageal sphincter to not work correctly, and then you get the reflux. It's not from too much acid, it's from too little. Okay, so all of this stuff, your body is intelligent, giving you symptoms for a reason. That's it. And go to Extreme Health Academy. Next week, we're going to talk about dementia. The week after that, we're going to hit autism. Okay, is that a problem with the nervous system? Or like back in the 40s when they first correlated it with the diphtheria and pertussis vaccine, is it just refrigerator moms, that the moms just aren't paying attention to the kids? Okay, we're going to go through autism, about the autistic tsunami. Dementia next week costs 4 times this country dementia than what cancer costs, but you don't hear of it. There's an underlying problem, okay, that's gonna bite us in the butt. And then we've got the Dr. John Bergman site. Check it out. Our articles on there are freaking amazing. They're really cool. I mean, we've got a writer that's an engineer, and he is just brilliant. He's like one of those guys that really likes research. He really likes data. I mean, I know he's a brother from another mother. Okay, now, I have the only mic. We can do a question and answer, but please make them short, okay? Because I have to repeat it. A good example of a bad question would be, my brother-in-law, he sells cars down at the thing. He was wearing a blue jacket the other day, and, he was talking to me. I don't want to hear that. Okay? So clear and concise. Yes, sir?
Yeah, does neuropathy affect a certain age group more than others?
Does neuropathy affect a certain age group more than others? Not really. Not really, because, now, if you were talking to me 10 to 15 years ago, I would say absolutely over 30 is going to be more popular, okay, or more common, or more prolific, okay? However, now we're seeing a lot of neuropathies in kids. If you see kids that are bouncing their legs around, okay, or have difficulty in paying attention, that could be a neuropathy from the poisoning of either foods, vaccines, or traumatic birth. So we're seeing it in every age group. Yes, ma'am.
For someone with stenosis who will come in as fast as she can to see you, what do you recommend for pain, the current pain right now before she can get to you?
For someone with stenosis, what can they do right now because they don't have access to a corrective chiropractor?
Yes.
Okay, good. I translated it just a little. The best stuff for pain, okay, is look at the biomechanics of what they're doing. Drink more water. Water is the best pain reliever, and that's something most people do dehydrated with. I mean, I've got this. No, it's not gin. Okay, it's water. Okay, it's phenomenal. It fills up the joints with fluid. It's excellent. Then look at omega-3s, fish oils. Okay, fantastic pain reliever, anti-inflammatory. Then look at direct application of heat. Okay, if you have a dehydration, diabetic neuropathy, or the blood just is unhealthy, because if that's the same person that you were talking about, we're talking a couple of surgeries, antibiotic use, so she's going to have leaky gut, she's high stress, poor sleep patterns. Anybody think she has high blood pressure issue? Yeah, it's supposed to be there. Okay, so water, omega-3s, direct heat on any type of joint, that's going to be a problem, and that's going to be the best. You want to stay the heck away from non-steroidal anti-inflammatories that destroy proteoglycan production of the building block of cartilage. So Advil, ibuprofen, Aleve, and even Tylenol is dangerous and toxic too. Yes, ma'am.
Water, is there any type of water that is best for our body?
Is there any type of water that's best for our body? Yeah. A mixture of hydrogen and oxygen. Yeah. I mean, the cool stuff, when you get it, because the water coming out of American taps has got glyphosates in it, it's got drugs in it, it's got fluoride in it, chlorine in it, it's a bunch of chemicals. So you need a system to get those chemicals out. It's like the system that we have in here. I looked for it. This is golden. Okay, it's got reverse osmosis. The problem with reverse osmosis is it takes the minerals out. So this thing remineralizes it. Then it alkalinizes it. Then it ionizes it so you can get it into the cells. Distilled water is really good for detoxing the body, but you need something with minerals so it gets into the cells itself.
The name of that system?
I think Eco Waterhouse.
Thank you.
Yes, sir.
Brings the question about with distilled water versus mineralized water. Is that whether it's colloidal or whether it's inorganic versus organic, our body can't absorb those kind of minerals, can we? Only plants can.
Okay, so I've got to repeat the question. Okay, if you add minerals to the water, can you absorb it? Yeah, like when you're talking salt, okay, if you have a little bit more salt in your system, you're going to be able to get that water into the cells a bit better. Ionized minerals are the best in the world. That means that you've got a plant that draws nutrient-rich soil that converts the copper, selenium, zinc, magnesium. Okay, I mean all of this stuff into an ionic form so you can absorb it. That's why most supplements don't work, okay, because they're iron ore. I mean, literally put a magnet on it. So your body isn't going to absorb them. It may absorb a little bit, but not a whole bunch. But the ionized minerals are the best. Even if it's not ionized, you're going to get some absorption, but not anything like if it's a plant-based. Good. Yes, sir.
This might be a little bit off topic, but how big a role do you see dental health playing in everything below the neck?
How big a role is dental health in everything below the neck? Vital. Vital. Almost every patient that we see when we're checking, because we do x-rays in this direction, if we see some metal fillings, man, it's particularly the amalgam ones, you got to get them out, and you got to get them out safely. And so the entire thing about dental health, it's so vital and so overlooked. I mean, by getting the amalgam out safely, I mean, you got to have a vitamin C IV. You've got to have special vacuums to get rid of the mercury. You got to have pure oxygen. You got to have a dam in the back. I mean, you got to replace it with something biocompatible resin or something safer. But you're going to see people with cancer still have amalgam fillings. People with dementia still have amalgam fillings. And it's like, are you nuts? Didn't your doctor tell you about this? Well, no. He didn't tell me at all. And we get patients that have gone through rounds of chemotherapy and you got this neurotoxic thing. You got people with Alzheimer's and you got the neurotoxic thing. Not even talking about cavitations inside from teeth that were pulled that they didn't remove the ligaments, or you got the root canals. Okay, so you got a dead hunking tooth in there that's just a harbor of bacteria. Yeah, that's absolutely vital. And that's pertinent to every subject.
So most current dental offices are actually toxic environments.
Most dental offices are taught sick environments. Yeah, they're not taught. In fact, though, one of the doctors, Hal Huggins, who exposed that, lost his license, and I mean, he's, everybody appreciates his information now because it's accurate. Yep. And next week, dementia. Of course, the people that really need it will forget. Thank you very much.